Did you know an entry-level doctor in Australia can earn about 90,000 Australian dollars a year? Then what about experienced doctors? Well, they can earn about 200,000 to 500,000 Australian dollars a year. And it doesn't stop there. Australia is facing a huge shortage of doctors, especially general practitioners. By 2030, the country could be short of 7,000 general practitioners. That means more job opportunities, better salaries, and strong demand, especially for international doctors. So why should you consider becoming a doctor in Australia? Let's break it down in today's video. So why is there such a high demand? Australia has an aging population and rising cases of chronic illness. In many rural areas, people don't even have access to a full-time doctor. To solve this, the Australian government is offering scholarships, fast-tracking visas, and giving extra benefits to doctors who work in these regions. So if you are a foreign-trained doctor, this is your chance. Let's break down the earnings a little more. A junior doctor earns between 80,000 to 95,000 Australian dollars. A registrar, that's a doctor in training, earns up to 160,000 Australian dollars. General practitioners earn anywhere from 125 to 300,000 Australian dollars, and specialists, they go from 200,000 to over 600,000 Australian dollars per year. If you work as a locum doctor, meaning you will fill in temporarily, you can earn up to 4,000 Australian dollars per day. That's huge. And it's not just about money. Australia also offers a relaxed, balanced lifestyle. Doctors usually work for 38 to 45 hours a week. They get paid overtime and enjoy generous leaves. You can even work part-time or take locum shifts to spend more time with your family, whether it's surfing, road trips, or just relaxing. The lifestyle is top-notch. Once you're registered with AFRA, that's the Australian Health Practitioner Regulation Agency, you can start your journey towards becoming a general practitioner or a specialist. You'll get access to career training, stable jobs, and even bonus incentives for working in rural areas. Australia supports international medical graduates, also known as IMGs, helping them grow, settle, and succeed. And you're not alone in this. Thousands of doctors from India, Nigeria, the Philippines, the UK, and many other countries have already moved to Australia. Many of them became permanent residents and even citizens. Australia values its doctors no matter where they come from. Now let's talk honestly. The process isn't easy. To practice medicine in Australia, you'll need to clear the AMC exams, prove your English skills through IELTS or OET, understand the Australian medical system, and complete the registration, which takes up to 1 to 2 years. Don't worry, we'll be covering the whole process in detail in the upcoming sections of the video. In the meantime, please consider subscribing our channel and press the bell icon. Let me tell you about Priya, a medical graduate from India. She cleared AMC exams, got accepted into GP training, and within 3 years she was working full-time as a GP in Australia. Today she earns around 200,000 Australian dollars per year, has weekends off, and spends quality time with her family. She says, Australia gave me the life I always dreamed of, and it all started with one decision. So why become a doctor in Australia? High salary, global opportunities, excellent work-life balance, career security, and path to permanent residency. If you're passionate, dedicated, and ready for the challenge, Australia is waiting for you. Now let's talk about the most important part, the pathways through which you can enter the Australian healthcare system as a doctor. There are 4 main pathways for international medical graduates. Standard pathway for most general practitioners. Competent authority pathway for doctors from certain approved countries. Specialist pathway for experienced specialists. Short-term training pathway for doctors looking for training exposure. Don't worry, I'll explain each one clearly so you can choose what fits you the best. The standard pathway is the most common route for Indian doctors and many international medical graduates. You'll need to pass 2 major exams conducted by the Australian Medical Council or AMC. Step 1, AMC MCQ exam. 150 multiple choice questions, computer-based, covers medicine, surgery, psychiatry, and more. Step 2, AMC clinical exam. 16 objective structured clinical examination style stations, realistic clinical scenarios, each last 8 minutes. Test communication, diagnosis, treatment, and ethics. Once you pass both of these exams and complete 12 months of supervised practice, you are eligible for general registration under AFRA. We will be talking about the standard pathway and the AMC exams in detail in the upcoming sections of the video, so stay tuned guys. Next is the competent authority pathway. If you've already cleared certain international licensing exams, you may not need to give AMC exams. Eligible authorities include UK's PLAB 1 and 2, US Assembly Step 1 and 2, Canada's MCCQE Part 1, Ireland and New Zealand's training systems. If you are eligible, you just need to complete 12 months of supervised practice in Australia, then you are eligible for general registration. This is a fast-track option if you already hold recognized credentials. Now let's talk about the specialist pathway for those who have already completed postgraduate or specialty training in their home country. You'll need to apply to a relevant Australian medical college like Royal Australian Australian College of Surgeons, get assessed for compatibility to Australian training, possibly do a period of supervised practice or exams. There's also a sub-pathway called Area of Need, where you can work in underserved regions while being assessed. This path is ideal for doctors who already have years of experience in a specialty. Next, we will talk about short-term training pathway. This pathway is for international medical graduates who want to gain up to 2 years of clinical experience in Australia without pursuing permanent registration. Requirements: college level approvals of Royal Australian College of Physicians or Royal Australian College of General Practitioners, approved supervised placements, temporary training visa. This pathway does not lead to general registration. Important note, this pathway does not lead to general registration. It's for learning and exposure only. Once you have cleared the required exams and training, the next step is applying for registration and a work visa. Registration is handled by AFRA. You must show English proficiency, IELTS or OET, document verification via EPIC or EICS. Visa options include 482 temporary skill shortage visa or 186 employer sponsored permanent visa. Also remember about Medicare provider restrictions and 10-year moratorium, which means new international medical graduates must initially work in regionals or underserved areas. And now it's time to explore AMC Part 1 and Part 2 in complete detail. We'll break down their structure, timeline, cost, preparation strategies and what life looks like after you pass. So sit back, relax and get ready. This is your complete guide to becoming a doctor in Australia. Let's start with the basics. Why are there two exams? The Australian Medical Council or AMC doesn't just want to test what you know. They want to make sure you can apply that knowledge safely and effectively in real-life Australian healthcare setting. That's why the exams are split into two parts. AMC Part 1 is all about clinical reasoning, how well you can apply your medical knowledge, think fast and solve problems. AMC Part 2 on the other hand tests how you perform. Can you handle real patients? Can you communicate clearly? Can you make decisions on the spot? These are the skills that matter when lives are on the line. Before you even think about booking your exam, there are few steps to complete. First, your medical degree must come from a university listed in the World Directory of Medical Schools and be eligible for ECFMG for your graduation year. All your documents must be verified through EPIC or ECFMG. This verification process can take anywhere from 2 to 6 weeks. Once that's done, you'll register on the AMC portal, upload your documents and pay around 642 Australian dollars. After that, you'll receive your AMC candidate number, but only once your documentation is cleared. And don't forget, you'll need proof of English proficiency to progress further in the process. Now let's dive into the AMC Part 1, the multiple choice questions exam or MCQ. This is a computer-based test held at person view centers all over the world. It's a single sitting that lasts 3.5 hours. You'll be presented with 150 multiple choice questions, but only 120 will be scored. The remaining 30 are pilot questions being tested for future use. The exam uses computer adaptive testing, which means the difficulty adjusts based on your performance. One important rule: once you answer a question, you can't go back. There's no backtracking. You'll receive a score between 0 and 500. Your results will be emailed and also be available on the AMC portal. You'll even get a detailed feedback to help you understand your performance. The exam content is based on the Australian curriculum framework for intern level doctors. Here's how it breaks down. 30% is adult medicine, 20% is general surgery, and the rest, pediatrics, OBGYN, psychiatry, and public health, law and ethics, are all 12.5% each. You can take the exam up to 12 times a year, and it's held globally. Booking usually closes about 3 weeks before the test date. The current fee for the AMC Part 1 is 2,920 Australian dollars. Now let's talk preparation. You'll need a solid 3 to 6 months of focused study. Recommended sources include AMC Handbook of MCQs, the Anthology of Australian Medicine, Tallies and O'Connor's, Mutter's, Therapeutic Guidelines, and popular MCQ banks like ACEQ Bank, AMC Wise, and Emboss. Simulate the real test experience. Set a timer, mix new and old questions, review your mistakes, and track your scores. Don't forget to use the official AMC app. Avoid common mistakes like skipping ethics, cramming rare diseases, or booking the test too early without enough practice. Now let's talk about Part 2, the clinical exam. An objective structured clinical examination. You'll go through 16 clinical stations and 4 rest stations, so 20 stations in total. Each station gives you 2 minutes to read the case outside the room and then 8 minutes inside to perform. Whether that's taking history, doing an exam, counseling a patient, or managing a clinical situation. This exam tests multiple domains all at once: your clinical reasoning, professionalism, patient interaction, and communication. These disciplines covered include everything from internal medicine and surgery to pediatrics, women's health, psychiatry, emergency medicine, medicine and ethics. You need to pass at least 9 out of 14 scored stations to clear the exam. 2 of the stations are pilot stations and don't count towards your score. Scoring is done using structured checklist and global ratings. If you make a serious safety or professionalism error, that can lead to immediate failure. Now where can you take it? Part 2 is available in person in Melbourne and select international locations. Some stations can also be taken online but follow the same format. The fee for the in-person exam is 3,000 Australian dollars and the online version is 3,400 Australian dollars. If you were charged more earlier, don't worry, automatic refunds are issued. Exam slots fill up fast, so plan 3 to 6 months in advance. And just like part 1, preparation is critical. Join study groups, do role plays, switch roles as examiner, patient and candidate, record yourself and review, use AMC clinical trials exams if available, and don't ignore soft skills like communication, confidence and understanding the Australian healthcare system. It matters more than you think. There is also an alternative to part 2. It's called Workplace Based Assessment or WBA. This is a 6 to 12 months hospital based program where you're evaluated by supervisors through direct observations and discussions. It's immersive but limited in availability and expensive, usually 10,000 to 12,000 Australian dollars. It's paid directly to the hospital, not AMC. Now, once you pass both AMC exams, you receive the AMC certificate. This certificate allows you to apply for limited registration, which lets you work in supervised hospitals positions. You'll complete at least 47 weeks of supervised practice across core specialties like medicine, surgery, emergency and more. After that, and once you meet all professional and language standards, you can apply for general registration and begin working independently as a doctor in Australia. And that's it for the video, guys. I hope you liked it and found it informative, and if you did, please press that like button and subscribe to our channel for more such content ahead. If you have any doubts regarding the AMC exam, please list them on the comments below. We'll be very happy to answer. I'll be seeing you in the next one. Till then, bye bye.